your sprayed your ass off. You know how like fast we had to run those before it's like shows, and then you go all the way back down.
Okay, so our presentation is on medical errors, and we will be referring specifically to the Josie King story. Just as an outline, we're going to be talking about who Josie was, some of the ethical issues that were present in her case, what could have been, how it could have been prevented, and what her mom and Johns Hopkins did to prevent further problems like this. So this is Josie King. According to Josie's story, she was an 18-month-old little girl from Baltimore, Maryland. In January 2001, she wandered off in her house, and she made it upstairs to her bathroom. And due to a faulty water heater, she received first and second-degree burns on her entire body. Her parents took her to Johns Hopkins, and she was placed in the pediatric intensive care unit. After around 9 days, she was moved to a step-down unit because she was doing well and they were overcrowded. So she had all new nurses that didn't know her case as well as her previous nurses. There she was prescribed morphine for the pain, but her mom didn't like how it made her almost non-responsive. She couldn't speak or anything, so they gave her methadone instead, which is basically morphine, but it's not as strong. Her mom noticed that every time somebody would walk by with a drink or something, she would start crying for it. She was giving her a bath one day, and she was sucking on her washcloth, trying to get all the water out. The nurses told her that was completely normal for someone in her case. Her mom also noticed that she was really thin and pale, and her eyes looked almost empty. Nurses again reassured her that was fine, it was normal. So she went home. She came home the next day, she came back to the hospital the next day, and Josie's eyes were in the back of her head. She was completely unresponsive. So they gave her Narcan to reverse the effects of the methadone. They gave her Gatorade, and she drank a liter of it. So the doctor gave verbal orders, no more methadone at all. Pain management came in to see her, and they decided that she did need it after all, so they gave it to her. Almost immediately she went into cardiac arrest. And a few days before her release, she actually passed away, and when she died, she was severely dehydrated, and she had an undetected central line infection. So our thesis is that we believe the doctors could have done more to obviously keep her alive, because when somebody's burned, you're supposed to give them fluid because they just lost a lot of fluid, and they should have took Josie's mom's concerns more seriously, and also took parental instinct more seriously to prevent these issues. And our theories are that one, doctors should take parental instinct more seriously to prevent anything from going wrong. And then the other theory is that doctors have enough knowledge to know the best course of action for their patients, and they should be trusted. So parental instinct. We all know the scenario when we were very little, and we would go into the doctor's office with our parents, and the doctor would say, okay, tell me about your condition, your medical history, what medicines you took, what times, when you got the fever, and right away we just are a deer in headlights and look at our mom like, talk for me, because we're so young and we don't exactly know all the specifics. So parents know our medical history. They know if grandma had some kind of disease that could affect us in the future, and they know our condition. They know what time we got the fever, what time it rose to, I don't know, even more. And they knew us from the beginning of life. So if we have something wrong with us, even if it's minor, like a facial expression or a color of our face, they would know if something was up. So a study was done that Berkeley wrote about, where interviews were done at a pediatric intensive care unit, where parents were asked their opinions on how important parental instinct was, and one mother said the minute something changed with her daughter, she knew it. And a father said the specialist and the parents, him and his wife,
probably knew the most about her condition than any doctors or nurses that came in for a couple minutes. And the third mother states that you can tell a nurse when you come into the hospital all about the condition, and they can write one thing down wrong, and it's nice for a parent to be there and be like, wait, no, that's not exactly how it happened, here's how it happened, just to prevent any errors or miscommunication. Now, the other theory that doctors should know the best course of action and should just be trusted automatically is paternalism. So they've gone through residency, nurses have done clinicals, and they've had so much schooling that you would think, oh, they'll know right away what to do. And especially for vulnerable groups, like people with dementia, children such as Josie was, sick people in general just are under a lot of stress, so you expect the doctor to be able to make the decision if they can't make it for themselves. Then you got to consider like communication, the time the doctor's in there to actually make a decision and see what your condition was, and the patient's capacity. So if they don't really know a lot about their condition, the doctor should probably know more. Their stress or memory, like I said, if you're sick, you're probably automatically stressed because you're missing out on things you would be doing, like going to work or school. And then obviously language and cultural differences can play a factor.
A medical issue that comes up is non-malfeasance, which is basically just not placing harm upon an individual, either voluntarily or involuntarily. As a medical, like a healthcare provider, they should have known that when it comes to burn victims, fluid loss is the #1 most important thing. So they should have known that whether if they gave it to her physically or through an IV, she needed some sort of liquid. Ignoring Sorrel King also harmed Josie because as a parent, she does know what's wrong with her daughter and how her daughter typically acts, and she knew that what she was doing wasn't normal for her.
So how parents can prevent medical error issues. First of all, make sure your health team is well informed. Right when you go into the ER, if any of you have been to the ER before, they ask what happened specifically, times, like I said earlier. They take your blood pressure and temperatures, things like that. So just make sure they know exactly what happened, times, and all of that. And then ask doctors to explain the medicines in ways that you can understand for your child, because they obviously cannot. And then speak your questions and concern, like Sorrel did, like, shouldn't she have some liquid? And the nurses assured her, no, it's okay, this is normal. Or why do her eyes look empty? Why is she pale and skinny? This is normal. It obviously was not normal. So how professionals could prevent these issues? First and foremost, follow protocol and give correct doses and check central lines, because actually before and after Josie's death, there were other deaths in the hospital due to central line infections, which is uncommon because you should have those checked. And a central line is like a large venous catheter, and it goes into large veins. It could be in your chest, abdomen, and another thing they could have done is just make safety a top priority, because in a hospital there are, it's for healing, hospitals are, but there are dangerous things in there, like the opioids and pain medicines and needles, and just make safety a priority. And then spend time with patients. I know there's a lot of patients in the hospital, but spending time really ensures a good outcome. And double check stats, and especially double check with parents, like, is this correct? And I believe inspections are done and should be done maybe more often, just to see if healthcare professionals are following protocol for safety.
So Sorrel King was Josie's mother. After her death, she got a settlement of $1.5 million, and she used some of that money to create the Josie King Foundation. which is just basically a foundation where they collect money to go towards hospitals to prevent more errors like in Josie's case. She also created the Josie King Patient Safety Program. She partnered with Dr. Kornagos. That's basically just a 6-step program that helps with communication between doctors, nurses, patients, and family members. She speaks at various conferences around the U.S. The first one she spoke at, a doctor actually recorded her and made a DVD out of it. And now she offers the DVDs to hospitals in return they give her a donation. And she also created the book Josie's Story, which is just more in depth about her case. And Johns Hopkins hired Dr. Miller, and she's basically just in charge of safety in the entire hospital.
So what did Johns Hopkins actually do to make up for Josie's death as much as they possibly could? Well, on the Hopkins medicine site, they said that the director of the hospital actually came to their house to apologize to them. And he said it was a rainy, cloudy day, and you could just feel the pain in the house without Josie's presence there. And he sincerely apologized, but you can imagine the stress on Josie's parents for just probably having her unsupervised for a couple minutes, and then that happens and leads to death. It's so sad, and then for him to finally come and apologize, that had to be some sort of relief. And then the Josie King Foundation funded safety programs for the hospital, and all human subject research at the hospital stopped once Josie died, and there were other deaths, like I said, with central line infections before and after her. And then movable carts were created, and these are just carts with the medicines and tools in them, and it just helped keep everybody more organized so doctors and nurses knew where things were. And then a checklist for central lines is created, so how to check it and make sure it's not infected, insert it, take it out, those kinds of things. And then a comprehensive unit-based safety program was created for all the medical professionals in the hospital to go through and check how much they know about safety. So if this story intrigued you, you can go to the website to know more about Josie and her foundation. If you'd like to donate, you just take out your phones and point the camera to this QR code, and it'll take you right to the site. Thank you. Any questions?
I think I might have missed this just in the intro. What year did this happen again? And then, if you guys know, where was her port? Where was her central line?
She got burnt in January of 2001, and then she ended up dying on February 22nd of 2001.
It didn't say where the central line was exactly, but when Josie's mom talked about her condition, she said she died from the medicines and the dehydration, and the doctor said it was from the central line. So maybe there was controversy from what she died from, and they didn't really say where it was.
Gotcha.
Well, if the central line was visible, wouldn't you have seen wouldn't you have been hot around the area and it's red? So do you think that maybe they just used that to cover up because it could have probably was dehydration?
That was my first notion, because dying from dehydration in a hospital is so absurd that I would think maybe they would use that as a cover-up. And Jade said, she had baths. It's you could see where it was inserted. You would probably be able to see if there's an infection. So it's kind of unclear, but that's what was in the article.
Isn't it normally in the bloodstream though that there's an infection in your central line? It's not on your skin.
Probably. I don't really know that much about it.
It's okay. I didn't know if that's
medically.
If it said anything about that.
The central line was actually removed, and they were debating about putting it back in, so it was no longer in her when she infection.
Yeah.
So maybe it was blood.
Gotcha.
Still,
Okay.
yeah.
So like you were talking about how like it's important for physicians and people like that to kind of listen to the parents and things like that. What would you do in a situation you feel like if you have like say like someone like if like an 18-year-old really going or someone without that primary guardian or things like that, like do you feel like the safety precautions that they put in are enough to kind of make sure that nothing like this happens again if you don't have the parent over your shoulder saying, what are you giving them, what are you giving them, like, because like you said, like we're all kind of like, you know what I mean, like you
Right.
ask, like you always look to your mom, but like I feel like there's a point where it's like, do you feel like those safety precautions that they put in are really going to make a difference, or is it just an overall thing that needs to change more?
I think it's always good, not even like a parent, but just a second party to come with you to the hospital, even if you are 18. But by the time you're 18, you should be concerned for yourself. And I know it's still a young age, but still asking questions and giving input to the doctors so they make sure they know everything about it so they can treat it precisely.
They also implemented the CUSP things, which is just better communication, so the doctor will like tell you what's going on in terms you can understand. But I mean, it can always get better.
I'll ask a couple questions. Okay, so I think I know the answer to this one. It sounds to me like it's unclear exactly what the error was. Is that true? That it could have been a line, it could have been lack of fluid? What exactly was the error?
Yeah, we believe it was a combination of things, but dehydration was stated. We got the Josie King book that her mom wrote, and then we looked on their site too, and on their site they mostly said about like central line. And in the book, Mom talked more about the medicine and the dehydration. Jay read the book. I don't know.
Yeah, in the book, she said overall she died from dehydration and wrongfully administered narcotics. But then later in the book, one of Josie's doctors like wrote her a letter and said that she had a central line infection and that he believes that that's what she died from, and he's like mad at himself for not catching it because like that's what he's trained for. So it was like both.
There was a settlement, a legal settlement. Did the hospital, you said somebody went and apologized. Did the hospital admit to there being a particular error?
The director of the hospital did.
And why was the research stopped? Was that something the hospital did, or the federal government said, we're not going to give you any more money until you fix this? Or?
It was the federal government.
Okay, two more questions. One is, do you think the hospital acted unethically, or was it just a mistake?
I think it was unethical for pain management to come in and try to overrule the doctor and say that they believe that she should have the medicine. I think that was unethical. And then the dehydration, like as a healthcare provider, you should know that fluid loss is the most important thing.
So it was a kind of negligence, or something they should have known that they didn't.
Exactly,
check.
just ignoring the mother's concerns and make her probably feel like she wasn't important, like her input wasn't important, then
Okay.
everything's going to be okay.
So that kind of goes into my last question. You mentioned two, what you call theories at the beginning. One, that you should pay attention to parental instincts, and the other that you should trust the doctors. I wonder if you could say something, or maybe you did and I missed it, about the balance between those two things. It seems like sometimes those could be in tension. Am I making
Yeah,
sense?
so those are two extremes, but there is like a midline where you should, like the doctor should take the parental instinct and concerns like seriously, and then the parent should trust the doctor to know what to do with that based on their schooling and knowledge.
I see.
So
there's a real cooperative behavior instead of one person taking charge completely.
Yes.
Okay. Good, thank you, that helps. Other questions?